The recovery from breast augmentation, it happens in phases really. There's a super early phase for the first few hours after surgery, where for the majority of patients there's a great deal of pressure on the chest. People liken it to when the breasts get engorged the first time they start breastfeeding, which apparently is extremely uncomfortable pressure. It starts to ease off during the day, and typically by the next day you just have some mild discomfort. Now there's restriction of activities for a little while. No heavy lifting, pushing, pulling, strenuous activity, and that's to avoid elevations in blood pressure, because one of the risks after surgery is postoperative bleeding around the implant, which typically requires an unplanned return to the operating room, which nobody wants. That's why we have those restrictions in place. In addition, you really shouldn't be driving for 5 to 7 days, at least. In terms of returning to vigorous activities in the gym, you could start doing walking and that sort of thing after 7 to 10 days, but in terms of heavy weightlifting and things like that, you really should wait a minimum of 3 weeks. Some patients might want to wait a little longer. In terms of returning to your normal day-to-day activities, it's not where you are, it's what you're doing. So if you work from home on a computer and don't have to drive to work, as soon as you're comfortable, you can return to work.